Welcome to today's COVID-19 update. It's Friday, April 9. Of course, I'm joined by the Honorable Minister of Health, Dr. Frank Anthony. Minister, it's a pleasure having you again on the program.
Well, thank you very much for having me on the program.
You're welcome again. Now, we have just completed another week of the vaccination campaign. I know the ministry would have said their aim is to vaccinate 40,000 persons this week. This is a two-part question. Can you first provide us with an update on this week's numbers? And of course, can you say how many of these persons received their second dose of the vaccine?
Well, so far, I think the vaccination program has been going quite well. Of recent, we saw more people coming out to get their vaccine. So on average, for the last 3 or 4 days, we've been doing about 4,500 vaccines per day, which has been a big increase because when we started out, we were doing probably about 2,000, then it went up to about 3,000. So now doing at least 4,500 a day is a big improvement. And we think that is going to increase as well. So as of yesterday, we had completed vaccinated 52,554 persons. So, you know, we are on target with what we've set out, and I think that's good that people are coming out to get their vaccines. As you know, most of the vaccines that we're using, they're 2 doses. So those persons who have taken the Sinopharm vaccine, many of them now are becoming due. And as of yesterday, we probably would have immunized about 60 persons who had received their first dose Sinopharm. Now they're getting their second dose. So about 60 persons now have received their second dose of the Sinopharm. They'll have to wait maybe another 7 days after receiving the second dose to be considered to be fully immunized. So all those who took the Sinopharm vaccine, within 28 days, they will be able to get their second dose. And those who took the AstraZeneca, we're asking them to wait at least for 12 weeks. Those who are now taking the Sputnik vaccines, they would have to wait for 28 days, and then they'll get their second dose.
Thank you very much, Minister. This second question, Guyana would have received the first batch of the Sputnik V vaccine Friday last. Can you say if we have started utilizing these already?
Yes, we have started to utilize the Sputnik vaccines. However, the rollout of these vaccines, we had to retrain our staff because these vaccines have to be kept at a special temperature. We have to maintain what you might consider to be a very cold temperature, -18 to -20. And once we thaw those vaccines out, you can't go and put them back into the fridge. So because of that, we had to retrain our staff how to use these vaccines. And we have now rolled that out to as many sites as possible. We have, I would say for this week, learning how to use the vaccine, we have completed maybe about 2,000 or between 2,000 to 2,500 doses of those vaccines.
Thank you again. And just a little follow-up. Do you have any idea of when the next shipment of Sputnik vaccines are?
We are expecting another batch in, next week.
Okay. And if someone tests positive after receiving their first jab, would this affect them receiving their second dose?
It depends. If they have not fully recovered, then we'll have to wait until they recover. Generally, when somebody is infected, if they remain asymptomatic or mildly symptomatic, it would take 10 days or so for them to be considered as having recovered. In other cases, people might become infected. They would exhibit maybe moderate symptoms, and those symptoms can persist for up to 28 days. So it all depends. So if someone has that type of experience, it's better for them to consult with their physician so that they can be properly advised, because each individual case would have to be considered. Also, what would have to be taken into consideration is what vaccine you receive as your first jab, and then how long the time interval you'll have to wait before you get that second jab.
Now, Minister, just permit me to ask another question. We have started our vaccination program, and of course we're aiming for herd immunity. What do you have to say to those persons out there, citizens who do not wish to take the vaccine? What could you say to encourage them and how to show them how this would help us in achieving this herd immunity and, of course, eventually eliminating COVID-19?
Well, if we don't achieve herd immunity, it means that the Guyanese population would still remain vulnerable to COVID. When we talk about herd immunity, we mean that a substantial part of the population would have received immunization. So even if there's infection, this infection would not spread. It would be contained because a lot of people would have had some form of immunity to fight off the disease. So that's what when we talk about herd immunity, that's what we mean. Not every single person would be immunized, but we'll have enough in the population to prevent the further spread of this disease. Now, with COVID-19, none of the vaccines that are currently on the global market have been proven effective against preventing the infection. And that's an important point for people to note. These vaccines have various levels of efficacy, but none of them would be 100% to prevent infection. So there's still that possibility that people, even being fully immunized, would have a little chance of getting infected. But it would be severely reduced because you're now fully vaccinated. But what these vaccines have done is that if you you're fully vaccinated, then it prevents you from getting the most severe form of the disease. So generally we categorize COVID as being asymptomatic, mild, moderate, severe, right? So it prevents you from getting that severe form of the disease, which means that it would prevent hospitalization. It can possibly prevent deaths, because when you get the severe form of the disease and you're in the ICU, you can end up with multiple organ failures, and which results in death. This vaccine, or these vaccines that we're giving to people, would help to prevent that. So it's important that if people really want to protect themselves, because we don't know who might end up in that situation. We have seen that while a lot of the deaths that we have had so far would have been older people and people with comorbidities, we have had a few people who were younger, who ended up in the ICU and end up dying. So we shouldn't take that chance. I think all of us love life, we want to live, and therefore one way of us to do that and to protect our loved ones is to encourage them to take the vaccine, because these vaccines work. There might be some people who have concerns about the safety of these vaccines. All of the vaccines that are currently on the market have gone through very rigorous clinical trials, and because they have gone through these rigorous clinical trials, thousands of people would have been given the vaccine, they would have been observed. We look for any adverse events. None of these things have really been found with these vaccines. So they are safe and they protect people. And even while there have been some discussion about the AstraZeneca vaccine as it relates to clotting, the cases that they have found, they cannot directly attribute those cases to the use of the vaccine. And the other thing is that generally in a population, they have found more cases of these types of events rather than just being caused by the vaccine. The vaccines actually cause less, or the thinking was that if it's associated, In one instance in the UK, I think they said it's 4 incidents they had to 1 million population, which is quite low. So when you look at even if you take that as a risk, the benefits of these vaccines, because these vaccines in the UK would have saved, literally thousands of lives. So the benefits of these vaccines versus whatever risk that might pose is very minimal. And most of the agencies, talking about the AstraZeneca specifically, most of the agencies in Europe, the WHO, have all pointed to this, that the benefits outweigh the risk. So these vaccines are all safe, and therefore people should have no fear whatsoever in taking these vaccines because they're going to protect you. They would not prevent maybe the infection from occurring, but if you do get the infection, you are not going to get the most severe form of the disease, and therefore it would protect you in that sense. So I want people to understand that, and that alone should be the motivation why you should go and get the vaccine.
Okay, then, Minister. Now, before we close off today's COVID update, I know you took your vaccine recently. Have you had any side effects, because I'm seeing you here every day, you come into COVID update, you seem fine, so just share.
Actually, when I took my vaccine, I really didn't get any side effects. Just a little pain, but not even that, I didn't feel anything. So really for me, I didn't have any side effects.
Then, well, thank you so much, Minister, and thank you again for joining us on COVID Update, and look forward to interview you again on Monday. And thank you also to the listening and viewing public. This has been COVID-19 Update. I'm Stacey Carmichael saying goodbye for now.